Basically, what we will do is allow Medicare to cover in-home health care.
Kamala Harris made a major policy announcement on The View, announcing that she will be supporting Medicare for long-term care at home. So, not Medicare for all. But there is actually a question later on that I will get to from Whoopi Goldberg that sort of doesn't bring up Medicare for all, but blasts private insurance. That is interestingly right now very hard to find on the internet. I'm trying to find the rest of this conversation, and that piece is missing. But hopefully by the end of this video, I will find that clip and share it with you all. But before I get to all that, this is a good policy, to be clear. This is, and not just because of the expansion into long-term care coverage, but what this also means for Medicare as a whole and the potential to continue growing it, to eventually maybe get to a place where it is a universal healthcare. But before I get to all that, there is some weird stories coming out of this appearance. This is one that really caught my eye and just made me laugh. So first, let me show you the clip that is apparently controversial to some people. This is Whoopi Goldberg introducing Kamala Harris on The View.
Welcome back. The next president of the United States.
That was enough, apparently, to set some people off. Here's a headline that came out of that. The next president of the United States. The View hosts treat election win as a foregone conclusion during cozy convo with Harris. Have you never seen a campaign rally? They always introduce the candidate as the next president of the United States. People already know Whoopi Goldberg supports Kamala Harris. Nobody was under any illusion that this is going to be a contentious interview with a bunch of hosts that I believe all support Harris. Alyssa Farah was in Trump's administration. I'm not sure if she does, but she has since been somebody whose job is to basically criticize Trump as a former Trump person. But regardless of, this is of course going to be a very cozy interview. It was expected to be. To hang on this, which is such a normal thing to say when introducing somebody you support, is so wild to me. But let's get to the actual policy here. So I'll get to Harris introducing it, and I like the story that she kind of discusses along with it. But the support for this is wildly popular. So from Data for Progress here, a bipartisan majority of voters support expanding Medicare to cover long-term in-home care. So look at the number here. 88% support overall. You will have a hard time finding another policy that has this level of support behind it. Democrats at 91, independent/third party at 84. Republicans actually support it even in greater numbers than independents do at 86%. And among the people that identify as disabled, this will impact them as well. 90% support it. Just popular across the board. So, of course, Trump is not supporting it. So his own record as president. Each of his White House budget proposals included cuts to Social Security and Medicare programs, including in long-term care. So from Forbes here, the last budget that he had, the 2021 budget, included approximately $500 billion in net Medicare spending reductions over 10 years, most of which would come from reduced payments to hospitals and healthcare providers. So even though he could say, oh, I'm not going to cut Medicare, the reality is he's cutting the programs that would impact the people that are on it. So including tighter eligibility rules for long-term care services would have limited access, saving $34 billion. Trump moving in the opposite direction, while Harris is taking on a solid policy. So here is the announcement when she brings it up on The View.
So, Sonny, like you, I took care of my mother when she was sick. She was diagnosed with cancer. And so it is a personal experience for me, as well as something I care deeply about. Taking care of a parent, that means trying to cook what they want to eat, right? What they can eat. It means picking out clothes for them that it's soft enough that it doesn't irritate their skin, right? It means trying to think of something funny to make them laugh or smile. And there's so much about that that really is about giving folks dignity. And to your point about being in the sandwich generation, there are so many people in our country who are right in the middle. They're taking care of their kids and they're taking care of their aging parents. And it's just almost impossible to do it all, especially if they work. We're finding that so many are then having to leave their job, which means losing a source of income. Not to mention the emotional stress. And so what I am proposing is that basically what we will do is allow Medicare to cover in-home health care.
All right. Pretty good. So I'm going to get some more details around why this is so important, as well as the rest of that clip. And hopefully, if I can find it, the clip of Whoopi's question afterward. But at the end of that clip, you can hear Whoopi under her breath saying, finally. I wasn't sure if that was because Kamala Harris took so long to finally get to the announcement or if it was because she's happy that this is being covered. I think it's the latter, but it did take a long time to get there. That said, there's more to this. In Harris's announcement on Twitter, she writes this: my plan will strengthen Medicare to cover home care services and support for seniors. This will include providing care workers with better wages, improving the quality of care for seniors and those with disabilities, and treating our seniors with the dignity that they deserve. And this is the impact. Like, it is crazy expensive. Long-term care services and supports are extremely expensive and not generally covered by Medicare. So across the board here, whether it's, adult health care, adult day health care, this is the median income for Medicare beneficiary, which clearly is nowhere near enough to cover any of these costs. But assisted living facility, so one private bedroom, around 64 grand. Home health aid for 40 hours a week, around 68 grand. Nursing home, semi-private room, 104 grand. 116 grand for nursing home, private room, and home health aid 24/7, almost $300,000 a year. So this should go to addressing a lot of that. This is from Pew Research, more than half of Americans in their 40s are sandwiched between an aging parent and their own children. So I've been hearing this term more often, the sandwich generation, or people that are sandwiched. This is essentially what that means. People that are caring for people that are elderly and children. That has to be an incredibly tough position to be in. So any help is welcomed. Nearly 20% of seniors require some kind of help with bathing, eating, and other daily life functions, according to the available research. The percentage is even higher for older seniors. Plus, there are non-elderly people who need these services because of disabilities. So again, this goes on to address all of that. Now, Medicaid is typically what is used to cover some of this. So the issue here, though, is that it's only available to people with low incomes, which means that families cannot qualify until they have spent down whatever savings they have to then be incredibly poor to then apply to get Medicaid. And in some cases, there's a process where you figure out ways to transfer those savings to relatives, and there's an entire legal specialty around this just to be able to apply for help through Medicaid. Just an insane system. When there are entire, industries built around how to get around a stupid system, the system clearly made the stupid. So it has to be addressed at some point. Thankfully, this is an attempt to try and address this insanity. And worth noting here as well, this is from Data for Progress. All state Medicaid programs are required by law to pay for care provided in institutional settings like nursing homes without delay. This creates a bias that pushes disabled Americans out of their homes and into institutional settings. So a lot of people that need this kind of care, they want to be at home, right? They don't want to have to leave their home and go to a special care facility. So this goes to address that exactly. And if this sounds familiar, any of this, it's because this was partly sort of in the Build Back Better plan that, of course, didn't go through because of Manchin and Sinema, who no longer are going to be Democrats. So they're no longer in the picture. That said, to pass this, Kamala Harris is obviously going to need the votes. She's going to need the Senate and the House to support this to pass it. But the Biden plan actually had this within Medicaid. So their plan was to expand Medicaid to include this, which again falls falls under some of the same issues that people already have with coverage through Medicaid. So this is bypassing all of that by putting it into Medicare. And they write here, in order to secure the necessary votes, Democratic leaders had to jettison the home care proposal. Yeah, so it was cut out of the program to get support from Manchin and Sinema on the Inflation Reduction Act. All right, let me get to the rest of that Harris clip, and then I'm going to try to find this Whoopi clip. Hopefully I can, because she brings up a great point.
And it's about dignity for that individual.
their
It's about
medication,
independence for that individual.
Yes.
I mean, people are of declining skills to some extent, but their dignity their pride has not declined.
No.
They want to stay in their home. They don't want to go somewhere else. Plus, for the family to send them to a residential care facility to hire somebody is so expensive.
Even separate from the actual policy here, I think this is just good politics. You are speaking to people's needs, a real issue that clearly, based on the polling I showed you, a lot of people support, a lot of people are struggling with, can relate to. You are speaking to that need that they have and addressing it with this policy. This is a solid, it's, again, in terms of a campaign and running for president and a policy proposal, this is a solid one to run on. It's also worth mentioning that she goes on to discuss how she's going to pay for it. This is, I didn't even bother including it because who cares? Like, this is the amount of things that the government does where there is no question at all about how they're paying for it. But when it comes to helping people, it's always, oh, how are you going to pay for that? Let's just push the need to even address that question aside. Who even cares? Now, I have searched and searched and searched, and I cannot find the clip that I was teasing earlier with Whoopi Goldberg blasting private insurance. I'm sure at some point it's going to be up in the full episodes that The View now posts on their official YouTube page. So if you watch through the full Kamala Harris interview, you will get to that point. But the point still stands here. And just to prove to you I'm not making it up, somebody else also caught this moment. Anthony here on Twitter writing, Whoopi complains about the bad, unethical behavior of private health insurance companies, and Kamala dodges the question. This is exactly why it was a mistake for Harris to abandon her 2019 universal health care plan. Americans hate the healthcare status quo. This is the issue when you listen to right-wing campaign advisors. So over the past month, Kamala Harris has taken on some of Biden's advisors, campaign advisors. I don't know why. Her support since then has stagnated since taking their advice and, embracing endorsements like Dick Cheney, who nobody likes, not even Republicans. So I don't know why you feel the need to do things like that. But this would be a way to, I think, win even more people over, because you are expanding Medicare. That's what this is. And you could have addressed Whoopi's question by pointing out, hey, this is a way to expand Medicare. And I think there is an issue with private insurance, and there are a lot of things that they aren't willing to cover, and you do pay too much compared to other countries. So with a policy like this, when we are expanding into long-term home care, this is a way for us to grow the circle even more in bringing people into Medicare that hopefully we can continue growing under my administration. Like, there's a way to address that properly, but instead she had dodged the question because, again, she's taking advice from right-wingers in her campaign. But let's hope she's able to succeed in spite of that, because this is a good policy, and hopefully we hear more about things like this as opposed to endorsements from Dick Cheney.